The question is true about renal artery is. Options are branches are the end arteries, anastomosis is at interlobar artery, anastomosis is in arcuate branches, and blood supply in medulla is greater than cortex. Before solving this question, we need to have two concepts clear. The first is, what do you mean by end arteries? And second is blood supply of kidney. So what are end arteries? End arteries, which are those arteries which are the only supply of O2 to the organ. So consider this as an abdominal aorta, and these are the two kidneys. This abdominal aorta give one branch to each as renal artery to both kidneys. There are not two branches from abdominal aorta supplying one kidney. Hence, these renal arteries are the end arteries. Right. So we get the answer over here that the branches are end arteries. But finding answer is okay. But we need to know the whole concept of blood supply of kidney. So I'll take this figure out and I will show you the blood supply of kidney in detail. Starting with abdominal aorta at L2, it gives renal artery, which on further branching gives 5 segmental arteries. Which are those 5 segmental arteries? Those are on anterior surface, it is apical, upper, middle and lower. On posterior surface, it is posterior. So this is an anterior side, this is the posterior side. We can see all the 5. This is a posterior side. Sorry, I wrote B over here, but it should be P, posterior. But through sagittal view, we can get all the 5. Apical, upper, middle, lower and posterior. Right. So, these 5 segmental arteries on further branching forms lobar artery. Form lobar, L-O-B-A-R, lobar. There should not be any L. Lobar artery, which on further dividing form interlobar artery, which on further branching forms arcuate, which on further branching forms interlobular artery. Then we have afferent arteriole, glomeruli, efferent arteriole. I will change the color, hence from here we will be starting the venous drainage of kidney. Then is peritubular plexus. Then we have interlobular vein. Then is arcuate vein, which on converging forms interlobar vein, which on further converging forms lobar vein, which on further converging forms segmental vein, again converges to form renal vein, and then it forms inferior vena cava, IVC. Okay, now moving towards the options. What do you mean by anastomosis? Anastomosis is when, suppose this is an organ which is supplied by two arteries. Means suppose if one supply is been cut, the organ is still alive because of supply of this artery. So this dual supply or this meeting of two arteries or any two you can say any two things is anastomosis. Okay, so also one characteristic of end artery is end artery never never ever anastomose. You know what? Why? Because it is the only one blood supply to the organ. To anastomose, there should be two arteries. For anastomosis, there should be two arteries. This is the requirement for the anastomosis, and end artery is the only one artery supplying to the organ. Hence there is no presence of anastomosis here. Okay, now I'll make some space over here, stating some facts about the blood supply of, I'll change the color, we'll take this one. Stating some facts about the blood supply to the kidney. That is, cortex have more blood supply than medulla. Okay, that is, cortex have near about 10% more blood supply from total renal blood flow. Okay, hence this option is also striked out. So you get the answer as the branches are the end arteries.